We have a lot of patients that get their teeth done and they really seek the opinion of either their wife or their child, and they might not have the same vision of what they think that their teeth should look like. And I think you should just want what you want. I think if you want toilet bowl white, you should get toilet bowl white. And if you want a more natural appearance, that's what you should get, and you should be really happy. And I think beauty is in the eye of the beholder.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Safina Leclerc, who graduated from dental hygiene school from Dalhousie University in Nova Scotia, Canada in 2009. She then practiced as a hygienist in Canada for 5 years and decided to pursue dentistry as she graduated from Loma Linda University in Southern California in 2018. She practiced for about 4 years and then purchased her own practice in Spokane, Washington, but really wanted to come back to Southern California. So she sold her practice and moved to Carlsbad, California. She primarily focuses on daily comprehensive dentistry and then full mouth rehab under general sedation. She named her practice Ranunculus to honor the Carlsbad flower fields. So Dr. Leclerc, welcome and glad to have you here.
Thank you. I'm excited to be here.
Yeah, so let's start from the very beginning. What got you first interested in the medical field?
I think that we just had a lot of people that went to church with us that were in the medical field, and they always seemed to really enjoy talking about their job and what they did for work, and their work hours seemed really nice. And I decided that I wanted to maybe consider it. So when I went to college, I kind of dabbled in a few areas and then stumbled upon dental hygiene.
Okay. And did you already know from the beginning that dental was the one you wanted to go into, or was it?
Not.
No.
No, not at all. Not at all. I had a couple of friends in my first year of college that were interested in doing dental hygiene. So they were doing the prerequisites, and then I started looking into it.
Got it. Okay.
Yeah.
So you basically started off as a hygienist, and you started your own.
Yep.
Oh, you got a practice, and then now you have another practice in Southern California. So
Yes.
what's that journey like? I mean, being an entrepreneur, starting your own business, what was that like?
I mean, it has a lot of challenges. It's actually really rewarding in so many ways because I'm a mom and a wife, and then I'm also a practice owner, and then I'm, a general dentist by day, and then practice owner the rest of the day. And so it can be challenging at times, but then also very rewarding. But the journey it's a lot, and it's ever changing. I mean, I'm still in it. It's only been 1 year since I bought this practice, and so I'm still in that journey.
Got it. Now, I want to dive a little bit deeper into the treatments that you provide. So I believe you do a pretty broad range from general dentistry, cosmetic, and even up to full mouth reconstruction. So I like to go kind of in the full mouth reconstruction. We can start there. What is full mouth reconstruction? Is that just like when you have to just redo everything in the mouth? And like, I guess, what situations does people get to that point? Is it more of like accidents, like a car crash or like a fall or something? Or is it more just years of neglect and it finally got to the point where something has to be done?
Yeah, it's not even sometimes years of neglect. I think a lot of it is just years of use of our teeth, right? So we use our teeth more than a lot of other body parts, and we're constantly chewing on hard foods, and we're chewing and we're enjoying, and we get dentistry slowly as time goes. And so we're always modifying the dentistry to the way the patient's mouth is so that obviously they're comfortable. And then it gets to a point where we've just gone a little bit too far. So, it can be from anything like full mouth of crowns where we're changing the bite because they have such a worn down dentition. We can be taking out a couple of teeth and putting crowns on a few, doing some implants. We can be doing a root canal. I mean, full mouth reconstruction can be a broad range of things. And it can also be as far as we're just taking all of the teeth out and we're doing implants with dentures. That's not my specialty. That's not what I primarily do. I primarily do the general dentistry stuff. So the full mouth of crowns, changing someone's bite, if they have a lot of crowding and they're older and they don't want to go through the whole process of ortho. So it's a mixture of things that we do.
Got it. Now, you also offer the cosmetic side, so like Botox and even fillers, which you really don't think that a dental office would offer that. But why do you offer these services?
you have a lot of patients that are interested in cosmetic work, such as veneers or porcelain crowns on all their teeth because all their crowns are different colors or, numerous reasons. And a lot of them also talk a lot about their face. And sometimes when you're trying to create a smile and you're trying to make it useful for them, they need a little bit of, lip filler, some cheek filler to lift the nasal labials. They need some Botox to get rid of some of the lines because they're trying to have a more youthful appearance. And so it also has there's other ways to also allow your smile to shine and be youthful. And so that's kind of what we offer, and patients seem to really love it. And they started asking me a lot, and so I started looking into doing a lot more courses for it.
Got it. Okay. So
Yeah.
then I guess how do you see merging those two areas when it comes like the cosmetic side for the teeth, but also on the face? Because you kind of mentioned that, well, people want to have that nice smile, but also for like the Botox and the filler. So kind of you're looking at the entire face. So I guess when people kind of ask you about it, does it seem kind of strange to them? It's like, oh, like you're doing the dental work and the face part of it, or not so real, not so much?
Um, Patients kind of go either way. A lot of them have already had a lot of Botox and filler done. I mean, that clientele is like in their 45s and 50s. And so they've already dabbled with it. And so they're kind of just like, oh, I just want to add a little bit here, a little bit here. I want to lift this up a little bit so that my smile looks, you can see my teeth more, or I want to just maybe add a little bit more filler to my lips. Or a lot of times I also do a lot of Botox for TMJ and muscle joint problems. And so then patients might have that because of a very collapsed bite. And so we'll also, do some neuromodulation. So there's different reasons we use it, which is kind of nice.
Okay. And I'm sure that when you have a lot of patients in your chair or asking you questions, I'm sure that there's a lot of misconceptions or myths that you hear from your patients.
A
What
lot.
would you say is some of those most common myths or misconceptions you hear?
One of the common things that I hear is, well, I'm not looking for anything aesthetic. And I'm like, no, I understand that. A lot of what we're talking about is function. So yeah, you're not looking for aligners because you want to straighten your teeth because you want straight teeth. We're looking at aligners because it's a function problem. We're breaking a lot of our teeth. We constantly have deep pockets. We have a lot of crowding in the front. We can't get our toothbrush and floss around. Our teeth are starting to get mobile in the front because of the position of them because they keep moving. So a lot of people, when we're talking about function, they automatically assume aesthetics because that's a lot of what we see online. And they're like really against it. And it's like, no, that's a lot of the misconception that I hear personally when I'm treatment planning these
Mm,
cases.
got it. Okay.
Yeah.
And let's say that someone is looking for a dentist, but they're not quite
Yeah.
sure who to go to. What
Yeah.
advice would you give to this person to help them find the right dentist, the one who has the knowledge, has the experience that they feel comfortable with, and can really help them with any of their dental needs?
Yeah, so I definitely think in dentistry, it's not so much about clinical skill. I think clinically, we're all clinically, we all came out of school being able to do the same stuff, right? And so it's not really I think a lot of it is how well you're able to manage complications for patients. I think that's a really big telltale sign is, when you're talking and you're doing your consults and they're asking really strategic questions, are you able to answer them? Can you say like, well, in my experience with this patient, this is how I handled it? Or, I think that's a really big thing. And a lot of it is just, are you comfortable with this person? Are you comfortable that they are going to give you what you're asking for? And then I think as the dentist, that's a really big thing too. Like, am I going to be able to deliver? Because every case that I consult, I don't do. I might refer them. I might recommend a different provider because I might not be able to give them what they need, or I just might not have the experience in that avenue. And so I will refer them out to places that, can better take care of them.
Okay. And when it comes to the educational part of it, because I'm
Yeah.
sure that some of these things that you do, especially like with the more serious cases, I'm sure a lot of people
Yeah.
don't understand kind of what's going on or why this is necessary. They either think that, oh man, like I don't want to go to the dentist, it's painful, it's not fun. And then you just told me I have all
Yeah.
these issues. Now I gotta spend a lot more time and a lot more money on this. Do I really need to?
Yeah.
So how do you
Yeah.
approach that educational component where you have to try and tell your patient, say, this is why I'm recommending this and this is why it's necessary?
Yeah, this is probably like the hardest part in dentistry. And I think I think, where the experience kind of speaks, and this is where patients, gain their trust, is how well you can explain to them the consequences of not doing the treatment. Because one of the realities of dentistry is that it doesn't hurt, and if you're able to chew your food every day, you don't understand why this is necessary. And it's because we see so many patients that are elderly that are now struggling because we never expected to live this long. We never really thought people that were 85 were going to be mobile and still needing dental cleanings, and they're still breaking teeth. They still have, crowns with recurrent decay, things like that. And so it's like trying to explain to them, like, this is so that you can function into that age, so that you're not so dependent on constantly coming every single time something gives you a problem, because we're going to get the function where it needs to be so that you can have confidence in chewing when you're older. And I think that's a really big thing, is how well you can manage the consequences of that.
Okay. Now, when it comes to just tips for everyday people to kind of keep in mind, 'cause I'm sure this is the one thing that you tell all your patients, they label, make sure you brush, make sure you floss, make sure you do kind of like the standards. But is there anything else that, if you had a microphone to everybody, that you would say, follow this advice, do this, and this is going to return so much more to you over the years if you just do this, or you're consistent with this?
Yeah, that's a tough one. I would say just consistently going in for your dental hygiene appointments. I know it can feel so daunting, and it's like annoying because you have to take time off work and go, but we're never going to be able to catch something if we don't see it. And we're never going to be able to keep you healthy if you don't come, right? That's the thing about dentistry, is that you actually have to come and get your dental health cleaning in order for us to keep the pockets shallow and keep the gums healthy, and make sure that there's nothing going on that's going to give you problems in the future. So I think that's what I would say is, making sure that you're committed to going to your hygiene appointments and that your compliance is there.
Okay. Now, when it comes to creativity, what role do you believe creativity plays in how you approach your patient care? Because I think when people think about medicine, especially dentistry, maybe creativity is not the first word that comes to their mind. Maybe they're thinking, well, don't be creative with me, just kind of make sure I'm okay. But what role do you believe creativity plays?
I mean, we create so many creative treatment plans for patients, right? Because not only do you have a budget, there's also, you are limited to how much bone you have. You're limited to the quality of bone. You're limited to the teeth. Like, you're limited in many different ways. And so you do have to be really creative in your approach and treatment plans. And that's probably like the funnest part, is getting to look at x-rays and create a treatment plan and see if it's going to flow well, how it's going to flow, where we're going to have hiccups, what a patient could maybe break, and getting them aware of. So things like that, it's really fun. So dentistry is very creative, but then also just the art of, sculpting lips. That's really creative, like doing lip filler. Everybody has a different idea of how they want their lips to look. Even just when it comes to designing colors, and when we're doing porcelain layering, we're really creative in what we tell our lab, or if we do it on our own in the office, we're really creative in how we layer porcelain to get the right translucency and the right colors. And so dentistry is very creative, but you don't have to be, right? These are all things that you don't have to do if you're not creative. Some people, they don't even do clinical dentistry. They just run the business because that's, what they really enjoy. And they're creative in creating systems, creating their profit margins, and there's a lot of creativity in dentistry.
Okay. Now, on a tangent from there, what about the importance of having an artistic eye? And I think in your case, maybe it's a little bit more prevalent because you also offer the Botox and the filler, not just the dental part of it. So, I mean, how important do you think it is to have an artistic eye in what you do?
I think it depends on the type of treatment that you want to do, but artistically, patients know what they want. I think you would be surprised. The patient that says, like, oh, I just want my teeth a little bit brighter and a little bit more square, they're the ones that really know what they want. They just haven't really told you yet. A lot of patients know because they remember what their smile looks like. So then they have like a backbone of what they want. So, in that sense, I don't think you have to be as creative. And honestly, filler can only do so much. You can only be so creative there. But artistically, like, because I know a lot of dentists struggle. Like, I'm not very artistic. Am I going to be okay? Like, you are still going to thrive in this career because so much of what we do that's artistic is it can it can be as big or as little as you want it to be.
Hmm. Okay. Now,
Yeah.
let's look clear. I'm sure that throughout your experience, you've experienced some maybe memorable cases you've worked on, or maybe even some
Oh
challenging
yeah.
cases you've worked on. Is there maybe one story that comes to mind that you're able to share of just one of those memorable cases and ultimately how you were able to give them a successful outcome in the end?
Yeah, I had one really fun case that I did. It was like a pretty big, it was a full mouth case. We extracted a bunch of teeth in the back. We did a bunch of crowns up front so we could get his bite opened, and then we did implants, and then we delivered all of the implant crowns. And what was really challenging was sequencing of time because when you're looking at the scans and the CTs, you're like the bone quality looks so good here, and then you go to place the implant and it's just twisting and the bone quality is not what you expected, and so now we're delayed a
Mm,
few months. And then you know, and patients sometimes they have their own idea on how long a case will take, but it was like your mouth didn't become this way overnight. And so we're not going to be able to deliver a functioning mouth for you right away. You can't run a marathon on a prosthetic leg before you learn how to just get used to it. So I think that's those cases are hard managing those complications. But I think as long as you're really honest, and I think something that we do really differently and what we offer is a lot of sedation dentistry. And so that's something that we make sure that the patients are always taken care of in that sense, because a lot of the reason why their mouth is the way that it is because they're afraid,
mm,
right? I
yeah.
think that's a component that people don't take into consideration. And when you talk to patients and you just give them this exorbitant fee for anesthesia, and then you like give them this huge fee for your treatment, that's a huge barrier. But when you tie it in and you break it up and you make it a little bit easier for them, and then you just always have that availability, I think that's something that.
Got it. Now, when it comes to the future, where do you think the future of dentistry is going?
Oh, that's tough because I have a lot of, 35, 37-year-old patients that just need a lot of dentistry because they got off their parents' insurance. And so I don't know how much of that we'll be redoing because if you were to ask a dentist 20 years ago, they would have told, well, I don't know if they would have known then what we know now. But a lot of what we do is replacing old amalgam restorations, replacing a lot of old single unit crowns. It's,
Mhm.
our main stuff. And it's because people still get decay. And so now I think we'll be replacing more implants. I think we'll be replacing more dentistry from patients that have really active disease that, yeah.
Mm. What about technology? Do you think that the increase in technology and in AI is going to make a pretty profound difference in the industry?
Yeah, I think implant precision is going to get really gnarly. I
Mm.
think one of the big things is, we've been placing a lot more implants than we used to. So our failure rates are a lot higher. Just the more you place, the more are going to fail. And then we're starting to see that. And so we're always trying to become more and more precise on how we can deliver implants and, restore them with success. So I think implant dentistry is going to become really precise. I think scanning technology, evaluating someone's bite, I think all of it's just going to keep getting better. And then even just materials. I mean, bonding materials have gotten so much better since the 80s. I think it's pretty cool. Yeah.
Mm. Okay. And with the future in mind, what's the vision you have for your practice?
Mm. I think for the future, the vision would be is just to help as many patients that are willing to take our help in restoring their health and their mouth so that their oral health, which is directly related to their systemic health. I'm hoping that we can get that word across a lot more so that patients see the value in taking care of their oral health. I hope that, we can just keep serving Carlsbad and taking as good of care as our patients as we can and giving them really high quality dentistry. And yeah, that's kind of what my hope is.
So it's a good vision.
Yeah.
Okay, well, Dr. Claire, I do have one last question for you, but
Yeah.
before I ask it, I do want to point people to your website at ranunculusdental.com. Now, last question for you. What does beauty mean to you?
To me, beauty means what makes you happy And I think I've learned that a lot in dentistry because we have a lot of patients that get their teeth done and they really seek the opinion of either their wife or their child, and they might not have the same vision of what they think that their teeth should look like. And I think you should just want what you want. I think if you want toilet bowl white, you should get toilet bowl white. And if you want a more natural appearance, that's what you should get, and you should be really happy. And I think beauty is in the eye of the beholder.
Okay, well, there you have it. Dr.
Yeah.
Sharing your expertise. Okay, so Doctor, where can people contact you in your practice?
So we do have a book online link on our Google business page, and then also directly through our website. You can contact us there, and then on Instagram, you can send us a message. We're all over.
Awesome.
We're all over the social platforms.
Excellent. Okay, well, Dr. LeClaire, this is great. Thank you for coming on. Thank you for sharing your knowledge.
Thank you so much for having us.
Yeah.
Thank you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.